CBS 46 News presents Public Affairs on Peach.
A world without breast cancer is a world with more birthdays. And signing up for the Making Strides Against Breast Cancer Walk will help us get there faster. The American Cancer Society invests in groundbreaking breast cancer research, and we're part of every community. In fact, 1 in 2 women newly diagnosed with breast cancer turns to us for support. Sign up today at makingstrideswalk.org. Together, we can turn this walk into a victory lap.
And isn't that such an important message from the American Cancer Society? They want you to join them for their annual walk, Making Strides Against Breast Cancer. Good morning, everybody. I'm Michelle Berto. I'm the morning anchor at our sister station, CBS 46. Of course, you know, October is Breast Cancer Awareness Month, and the American Cancer Society wants to make sure the public has all of the latest information possible in their fight against breast cancer. And that is why we are bringing you more information today with Chief Medical Officer for the American Cancer Society, Dr. Otis Brawley. Thank you so much for being here.
Thank you for having me.
What is the one thing that most people have a misconception about when it comes to breast cancer?
Well, one thing about breast cancer is people need to realize that women of all ages from age 40 onward can get it. There's some people who think of it as only a disease of women in their 40s and 50s, but we need to think about women in their 60s and 70s as well. The other thing that people think about is that, believe it or not, it's contagious. There are people who think it's contagious. It is not. And then what we really want people to think about is have a good diet, have 5 to 9 servings of fruits and vegetables per day, maintain a normal body weight, and try not to gain weight during adulthood. These are things that can actually cause breast cancer. And then be aware of your body. If you feel something in your breast, go to a doctor and get it checked out. And we recommend that all women age 40 and above get a good quality mammogram and clinical breast exam every year, and realize that even that screening has some limitations.
And we're going to dive into that in a little bit, but what you said before is very powerful, because taking care of ourselves, our diet, our exercise, those are things that we can control.
That's right.
There are some things that we can't control, for instance, our genetic background.
That's right, that's right. A risk factor, well, the first risk factor for getting breast cancer is being female. 99% of people who get breast cancer are women, 1% are men. The next is family history, which is something we can't do anything about. Women whose mother, aunt, or I want to look at aunts on the father's side of the family, have breast cancer or have had breast cancer, especially have had breast cancer at an early age. They're all at higher risk, and they need to be especially vigilant for breast cancer.
So what can we do? We hit the age of 40, and I have to be honest with you, doctor, over the past 2 years, it got a little confusing. Do we go for the mammogram when we're 40? Do we go every other year? Because that study that came out just a couple of years ago muddied the waters for a lot of women out there.
I admit that that study did muddy the waters. Our trying to just say something very quick and easy also, I think, muddies the waters. What we recommend currently is that all women age 40 and above get a high-quality mammogram and a clinical breast exam on an annual basis. Not just the mammogram, but also the clinical breast exam. We also recommend that women age 40 and above realize that that high-quality mammogram and clinical breast exam does have some drawbacks. It's going to miss some cancers that we wished it would have found. It's going to cause some women to be called in and said there's an abnormality, we need to do further testing. Indeed, for women in their 40s, getting an annual mammogram, about half over that 10 years are going to be called in and said, there's something wrong, let's do further testing. They're going to be frightened
really
about
scary.
that. Right. They need to realize, overwhelmingly, those women are not going to have breast cancer. And it's about 1,900 women screened every year for 10 years in their 40s to save one life.
So still, if you're above the age of 40, go for your mammogram every year and your clinical breast exam. By the way, quickly, what's the difference between the clinical breast exam and the mammogram?
The mammogram is an x-ray where the breast is actually put into a machine and compressed, and an x-ray is taken. The clinical breast exam involves a nurse or a physician actually doing an examination. It usually takes about 10 minutes where they take their hands and fingers to feel the breast looking for lumps.
Okay, and then so at age of 40, you go through all of that knowing that 1 out of 2, 50% of the time, you could get a call back saying, hey, listen, we have to get you some more tests. Know that going in so you're not as afraid when you get that phone call, right?
And know that overwhelmingly those women who are called back will end up being told, everything is fine, we're sorry we bothered you.
Okay, for the women that doesn't happen to, what do we do then? You get that diagnosis, and then what do? Turn to the American Cancer Society?
Feel free to call us on our 800 number or go to our website to get further information about breast cancer and breast cancer treatment. Get support if you need breast cancer treatment, or if you need help to get to the doctor or other things, even help with in terms of handling insurance and that sort of thing, give us a call. And that's incredibly important. You know, we have a study that was done in Atlanta about 5-6 years ago that shows that 7% of black women who are diagnosed with breast cancer, about 2% of white women, get no treatment in the first year. They're diagnosed with a cancer, but they end up not getting any kind of treatment.
Because of fear, because of lack of transportation, because they don't want to miss work, all of the above, right?
Lack of insurance, all those things come into play, a number of logistical issues.
Okay, we're going to dive more into the logistical issues with the program that is available to people who are battling breast cancer. We're going to talk about that after the break. Dr. Otis Brawley, thank you so much for being here and sharing all of that information. We truly appreciate it. So stay with us, everybody. We are coming back with a breast cancer survivor telling her story and how she used a lot of exercise and some good positive spirit through her journey, and now she's helping others.